All right, everyone. Well, welcome to the Hemophilia Council of California and our first policy and advocacy webinar of 2021. This is the state of healthcare in California, what you need to know. My name is Lynn Kinst. I'm the Executive Director of the Hemophilia Council of California, and I want to welcome you today to our webinar. We also have with us Terry Cowger-Hill, who I'll be introducing in just a moment. Who will also be helping provide an update on what is happening in our state capital. So we also wanted to highlight mental health resources because we know that this has been a particularly trying time for many of us, and that a lot of folks are needing some extra support. So we want to encourage you that there are resources available, that mental health and behavioral health services are covered benefits under Medi-Cal, under GHPP, and under CCS, as well as under many private insurance in California. So this is a very text-heavy slide, and I'm not going to read all of it because I do want to acknowledge that we're a few minutes over time, and I thank you for hanging in with us. We just have a few more slides. But the slide deck will be on our website, and so you'll be able to access these resources. And we actually have a longer document that we created for a webinar that we did a couple of months ago on mental health that has some additional resources besides what's listed on this slide. And we will post that resource sheet along with this webinar as well, for those that want more information on the mental health and behavioral health services that are available, particularly through the state right now with Medi-Cal, GHP, and CCS. So I just have a couple of slides to wrap up with, and I do see a question in the chat. If you have any other questions about the items that we've covered, please go ahead and add them while I'm chatting here on the last couple of slides. Wanted to let you know what the council has planned for 2021. We will be continuing our policy and advocacy webinar series throughout the year. So please watch for more updated information on that. Want to let you know that NHF is having their Washington Days virtually this year. So it's a great opportunity to participate in Washington Days without having the expense of traveling or having to necessarily, take full days off work. You might be able to juggle your schedule to participate. The registration deadline is February 5th, and we have posted that information on our social media, but you can reach out if you need help finding that. Future Leaders and Legislative Day will be happening again virtually this year, so we want you to watch for more information coming soon on those. We have a policy summit scheduled for February 25th and September 23rd, and then we'll be continuing to update you through policy news, action alerts, and in collaboration with your local Bleeding Disorders Foundation. So the next couple of webinars, we're going to be really focusing on advocacy and preparing you to participate in our virtual legislative days. So next month in February, we'll be talking about the power of lobbying and demystifying the process and using your voice to be heard. And then in March, we're going to do a two-part workshop on the art of telling your story, which we're really excited about. Something that we do always with our future leaders, but hasn't necessarily been an option for adults to participate in who are not of the age for future leaders in the past. And then in April, we'll be focused on preparing for that legislative day 2021, a virtual advocacy primer. So lots of exciting topics coming, and we look forward to you participating in those. So I want to thank our 2021 Public Policy and Advocacy Webinar Series sponsors, BioMarin and HF Healthcare. And with that, I want to go back and I do know that there's a couple questions in the chat here. So, excuse me. There was one question. I answered a couple questions in the chat. There was someone who had a question about thinking that that with CalRx, it meant that folks would be getting their coagulation products through Magellan instead of their SP. So that's an important point of clarification. You can still stay with your same SP or your same 340B pharmacy. Most of the pharmacies that folks have been working with are still all contracted with the state of California. It's just your pharmacy will be working with Magellan to process their payment. So Magellan will just be acting as like an intermediary for the state to process those payments. It does not mean that all patients have to go to Magellan as their pharmacy. So hopefully that clarifies that question.
And I would just say that the council has worked really hard over the last year. We had several conversations with the Medi-Cal Pharmacy Benefit Unit, and they assured us that they will still have responsibility over the policy for all drugs, so that there are no anticipated changes in drugs that are covered under Medi-Cal currently. So again, Magellan is just for processing purposes. But if you are an SP or a 340B pharmacy and you have patients right now where you deal with the SARS and the payment through the fiscal intermediary or the SARS through the Department of Healthcare Services, that will change April 1st and be moved to Magellan. So you must get trained. Go to the CalRx website and get the information on how to be trained to process those Magellan claims.
Right. And then we had a question, can you comment on GHPP's current monthly authorization requirement? We are hearing from HTCs that monthly authorizations are required for emicizumab or Hemlibra. Is there a monthly authorization requirement for clotting factor? Terry, I have some thoughts on that, but do you want to take that?
Go ahead.
So I think currently there has been a monthly authorization requirement, but my understanding is that once we move to CalRx, they're going to be having a longer authorization period. Wasn't that what we heard?
I think so.
Yeah. So, but we can check, we can double check that with the policy unit.
And they had actually extended flexibilities under COVID, and we're still in the middle of the pandemic. So I don't think anything will change to what's currently happening. And you should be on the website so that you get information. All the pharmacies should get updates and notices directly from the state.
That's also a good point, is that there were additional flexibilities put into place because of COVID. So then there was also a question where there was a couple of comments about, mental health is covered under GHPP and Medi-Cal, but it can be extremely difficult to find providers that will take. One person commented about difficulty finding providers for GHPP, and one person commenting about difficulty about providers that take Medi-Cal. So I agree. Honestly, the resource sheet is really just a starting point. It is one of our sort of priorities this year to begin to really think hard at the council about what we can do to help figure out how to make resources more available. And I don't know, honestly, at this point, what the solution to that is, because it can be very difficult to find providers. I think sometimes it's difficult to provide providers when you have private insurance too, frankly, exactly. in personal, helping others in personal experience type situations. So I have reached out myself to some other mental health organizations to see if there's any way that the council can partner with some other organizations that are already in the mental health space to figure out if there's a better way to bring more resources to our patients. And it's definitely something that, the conversation is kind of just beginning, but that's something that we want to talk to the other local, the other organizations in California about how we can support any efforts that they might be engaged on to try to bring resources to the community. So yeah, and again, a list of providers. I don't know, I think I searched the state websites for that, and I'm not sure that I found that. Generally, the state kind of shies away from providing provider lists.
And
But
that varies as well based on the Medi-Cal managed care plan. So each Medi-Cal managed care plan in California has their own network of providers. And so you'd have to get that from each of those individual plans.
yeah. So, but we will, we're definitely thinking about ways that we can try to get more information that will be helpful to patients to actually access those resources, because we do realize that that's a challenge for sure. I think that covers all the questions in the chat. Is there any other questions that anyone wants to add or even unmute and ask? Because we are over, but I think we wanted to get to all the questions. Oh, and just for those that are asking about that, Mosey Williams, welcome Mosey, who is one of our newest board members. So thank you for joining us. He added into the chat psychologytoday.com, which does have it is a resource of a place to search for providers by insurance type. Excuse me.
But as Lynn mentioned, it is a problem in the private sector. I know Kaiser has a really good track record for providing mental health services in their system for their patients and consumers. But if you have other health plans or other private insurance and need to access mental health or behavioral health, it's a challenge. So it goes beyond even with the state programs. And again, we're not equipped to provide all of the answers today, but it is something on our radar that will continue to collaborate and coordinate with others to hopefully provide more resources to our community.
And I would just add one more thing for those of you that are social workers on the call or maybe do some of this work that have some resources that have worked for you in the past. As we work to compile like resources that are truly going to be beneficial to patients, if there's any suggestions that you have for us, please feel free to send them to me. That my email is up on the screen right now. And I would love any ideas or suggestions that you have to help the larger patient population. So, and Patty, you asked the question, did we announce the new board members? I did not. I neglected to do that, but it's a good opportunity as we wrap up. We have 3 new board members at the council this year, and that is Mosey Williams, Cindy Guzman, and Stephanie Dansker are our 3 new board members. And Mike Bradley was our outgoing board chair, who's still serving on our board now as our vice chair, and Adam Wilmers, who has been our advocacy committee chair and also a representative to the CCS advisory group on behalf of the council, is now the board president or chair. So those are our newest additions to the board, and we're excited to have them and new energy and ideas. So with that, we have gone over our time. So I want to let everyone go, but thank you so much for joining us today. Again, the slides and the resource page will be up on the website later this afternoon, and we will get the video edited and up in the next couple of weeks. And we really appreciate you joining us today. Hope that you found this helpful, and just say thank you again to our sponsors, to BioMarin and HF Healthcare, for helping to make today's webinar possible. Thanks so much. Bye-bye.
And I also wanted to let you know the slides are actually up there now.
Ooh, Andrea is on it. Thanks, Andrea. All right. We'll hope to see you all soon. Stay safe. Bye-bye.